Hello and welcome to a special interview for The Wire. The World Health Organization's estimate that India perhaps has as many as 4.7 million COVID-related deaths, almost 9 times more than the government's official figure of 524,000, has created a storm of controversy and one that you certainly cannot have missed. The Indian government has responded angrily and bitterly. Now we know how the World Health Organization has stoutly defended its estimate, but what we don't know is how is the World Health Organization responding to the criticisms from the Indian government. That's the key issue I shall raise today with one of the world's most famous epidemiologists, professor of epidemiology and the founding director of the Center for Global Health Research at Toronto, and a member of the World Health Organization's Technical Advisory Group, Professor Prabhat Jha. Professor Jha, let me start by pointing out to the audience what I'm not going to speak to you about. I'm not going to ask you to defend the World Health Organization's estimate of 4.7 million COVID-related deaths because you've done that many times before. Instead, I'm going to put to you the criticisms made by the Indian government of that estimate and of the methodology used by the World Health Organization. And I'll take you through those criticisms one by one. Perhaps the most basic criticism is that India has been considered a tier 2 country and not included in tier 1, although Iraq, which the Indian government has described, and I'm quoting, as a war-torn country where data collection, analysis, and reporting can be questioned, is in tier 1. So has India been wrongly categorized?
Thank you for the invitation, Karan. So first, let me state up front that I did not write the WHO report. I only reviewed it. I'm a member of the WHO's advisory group, but I'm not speaking on behalf of WHO. And as disclosure, I get no money from WHO or any other groups for my scientific opinions. I'm a tenured faculty at the University of Toronto. And quite frankly, I have no axe to grind with any government or any officials, and I'm completely apolitical. My main interest is to count the dead, to help the living, to improve public health and the life of the common person. So to turn to your question, the classification the WHO used is not a commentary on the country, but simply grouping them on the availability of monthly mortality data. So Iraq is a tier 1 country because it provided its monthly all-cause mortality data by age for the entire period that WHO requested. India did not. And as far as I know, they have actually not sent data to WHO since 2007.
In other words, Iraq is tier 1 because its data has been supplied to the WHO regularly, monthly, as you pointed out, and in a way that is reliable and accurate. India does not supply monthly data, and as you say, it probably hasn't supplied data since 2007. And that, by my rough calculation, is 15 years ago.
That's what I understand. I think detailed data that the Indian government could release, and you could argue that it shouldn't be just released for the WHO's sake. All of the key data should have been in the public sphere on a website for scrutiny. In a great democracy like India, that would be appropriate. But the Indian government has not chosen to do that. It's chosen to only leak selected data and not make all data open.
So in fact, data hasn't been made available to anyone, not just to the WHO, but not to anyone.
Correct.
Now, the second criticism from the Indian government is that the government claims it has a robust civil registration system of deaths, which the government claims accounts for 92% of all deaths. In contrast, the WHO figure of 4.7 million COVID-related deaths suggests that India has missed 90% of COVID deaths. How do you reconcile these two different claims? India claiming 92% of all deaths are recorded, the WHO estimate suggesting that 90% of COVID-related deaths were missed.
India does not register 92% of deaths. This is just fantasy. First of all, the number of deaths in India every year is about 10 million or 1 crore, and that's been pretty stable over time. Now, the Indian Registrar General claims that only 8.3 million, 83 lakh deaths occur a year, but that's based on the sample registration system, which is well known to have undercounts. So consider the 2011 census and the direct questions on the census that enabled to measure how many children were dying showed that child death rates were about 30% higher than what the SRS estimated for that year. Recently, the nationally representative National Family Health Survey, number 5, which covered 2019 to 2021, found that death registration was only 71%, lower in the rural areas and higher in the urban. So the 92% or even the 99% figure is fantasy. But here's a simple way, Karan, to think about the 47 lakh deaths that WHO has estimated. So first, let's just focus on the lower bound, which is 33 lakh, and ask, is that plausible? Well, of those 33 lakh lower bound deaths, 27 lakh were estimated for 2021. So this 27 lakh figure is actually very consistent with our study, which relied on a national poll of over 1 lakh Indians. It's also very consistent with the Ministry of Health's own data on their website covering 2 lakh hospitals. Now, in non-pandemic months, on average, India will have just over 8 lakh deaths a month from all causes. So this was what happened in 2018 or 19. So you ask, well, how can you get to 27 lakh excess deaths? All you need is for the overall death rates to just double for 3 months. So if your viewers ask themselves during April to June of 2021, did they hear at least twice as many deaths happening in their social circles versus usual? I think the answer would be yes, unambiguously. And if today your viewers go out and ask 5 of their neighborhood friends and ask in their homes if a death occurred in 2021, they'll probably find that yes, at least roughly 1 in the 5 homes did have a death. But if they ask, did a death occur in 2019, you'd need to ask about 20 to 30 houses to find a death. So this is just common sense that this very large total actually can occur in India simply by a doubling of the death rate for 3 months. And I think there's very little ambiguity that among the people of India that actually occurred. In some cases, as you know, it was far worse than that. You heard about entire families getting affected and 2 or 3 people dying. So the WHO estimate is high, but it is very plausible.
There are 2 things you said there that will have struck the audience, and I want to clarify that you actually meant them as strongly as you said. First, you said that the Indian government's claim that 92% of all deaths are recorded by the civil registration system is pure fantasy. You use the word fantasy. Now, this is a figure that not only does the government believe is correct, but no Indian media has challenged, as far as I know, not a single one. So you stick to your term that 92% deaths being recorded by the CRS system is pure fantasy.
It is, yes. I mean, the National Family Health Survey showed it was 71%. Independent demographic groups have shown that the actual coverage of registration might be around 80 or 85% at best, but nothing like 92 or higher percentage. And you have to remember the underlying denominator here. If the government of India says that India only has 83 lakh deaths, whereas the UN, the World Health Organization, various demographers, our group, say that India has 1 crore deaths a year, then right away that's a difference. If you have a lower denominator, then it's easy to say we're claiming 92% coverage, but those aren't true. Anyone serious about Indian demography will tell you India has about 1 crore deaths a year, not 83 lakh deaths a year.
The other very important thing you said, which would have stuck in people's minds, is that you only need to double the number of deaths that actually happened in 3 months to bridge the gap between what India claims and the WHO estimates. Again, do you really mean that it's simply a matter of doubling in a 3 month period to bridge the gap? Or have I misunderstood that?
That's very much the case. And in fact, for the Government of India press release that occurred, one thing that they could do, which they have, is release the CRS data, the civil registration data, monthwise. So in 2020, we know the excess was really in September and October. So is that where the excess deaths occur? And similarly, in 2021, when the CRS is released, release it monthwise. The Indian government knows this and yet has been reluctant to release it because of the concern that, in fact, those findings will confirm these very high estimates. And I go
In
back,
other words,
sorry, go ahead.
In other words, the Indian government is deliberately not releasing data monthly because it will confirm the high estimates. When you release it annually, you tend to blur the picture.
I think the concern is always to paint a rosy picture, but this is self-defeating if the Indian government is not reliably counting deaths, then it will not be able to establish the true success rate of an extraordinary effective vaccination program. I think we have to realize that there were many things that went wrong in India, but the rollout of the vaccine program has been extraordinarily successful and historic. No other country has been able to do it so quickly. But to know whether that worked, you have to know whether deaths were reduced and in which populations. Did it differ by rich people or poor people? Did it differ by women or men? Different by age group. It's very basics that the Indian government needs to acknowledge and ensure that its data support those positive developments.
Now, when the WHO went public with its findings a few days ago, you very kindly shared with me a personal calculation you'd done, and I'd like to refer to that very briefly. You believe that if you compare India's official CRS deaths for 2020 with those for the previous 2 years, not just for the previous 1 year, but the previous 2 years, which are 218 and 219, you get 0.82 million excess deaths for 2020, and that's an 11% excess death count. You believe that this actually corroborates the WHO estimate. It doesn't contradict it. In other words, even the CRS system that the government claims suggests the opposite to the WHO, you're saying corroborates it. Could you explain that point to the audience?
Certainly. So if you take the Government of India's 2020 CRS deaths, which was in their press release, and from that subtract the average of 2018-19 deaths. And the reason for taking an average is that it's more stable than simply taking 1 year. Then the difference between those two is roughly 8 lakh deaths. And that's an 11% excess versus the 2018-19 baseline. Now, WHO's estimate was also 8 lakh excess deaths for 2020, but their percentage was 9%. Now, why the difference? Well, because they adjust for the undercounts in the civil registration system, so it's more conservative, but broadly similar. So to really settle this, what the Indian government could do is release the monthly data, and if the excess was concentrated in September, October, then that would confirm. But the important thing here is not so much 2020, it's what happened in 2021. And the government's own data, the confirmed COVID deaths, say that in 2020, there were roughly 1.5 lakh deaths. But in 2021, about 3 lakh deaths. Again, common sense would say that does anybody believe that the 2021 killer wave in April, May, June was only twice as bad as the previous year? I think no one would really think that's a credible stance. And the 2021 wave was a giant Delta wave that overcame even well-running cities and hospitals. And we know how much tragedy and suffering that caused. And I believe we owe it to all those who lost a loved one not to ignore their tragic losses. Counting the dead is a moral responsibility that we all have.
Now, so far, Professor Jha, we've been talking about the total estimate put out by the WHO of 4.7 million COVID-related deaths compared to the government's official figure, which as of today is 524,000. Let's now come to a second order of concerns the government has, this time to do with methodology. The government says that rather than rely on India's civil registration system, which it insists is robust, the WHO has used a methodology which the government calls, and I'm quoting the government, statistically unsound and scientifically questionable. How do you respond to that rather blunt, dismissive criticism of WHO methodology?
The WHO method of excess death is widely accepted in scientific circles as imperfect but valid. And we, for example, applied a very similar approach in our paper in Science just for 10 states because they had more complete data and found almost identical results. Now, the truth is that any one study, including WHO's, has its weakness. But if you look at roughly 12 independent studies using various methods and data sources, they all point to the actual toll of at least 20 lakh, maybe as high as 40 lakh deaths, or at least 4 to 5 times higher than the Government of India official totals. So every method has some statistical problems, but putting together all of the evidence is unambiguous. If 12 of the studies point in the same direction, then they are far more likely to be scientifically sound.
So you refute the claim that the methodology is statistically unsound and scientifically questionable.
That's a sound bite, it's just not reality.
Now, let me give you 2 examples, or maybe even 3, that the government has cited to try and justify that comment. First of all, the government objects to the fact that the WHO has used data put together by different media organizations or by different academics from 17 states and extrapolated that data to cover the whole country. The government says this extrapolation is wrong because states differ with each other, often very considerably. Is the extrapolation justified or is it erroneous?
The method used relied on state-level monthly data from each state's own reporting and their civil registration or registration reports, as well as RTI information that many journalists obtained. So these are the state's own data. They're not made up. They're not journalistic inventions. And the approach was to take about 17 states, which constitute 60% of the population. And then it's a simple extrapolation to other states with very little modeling or covariates involved. And it's the way to think about this is very reasonable. If a weather person were to say it is raining in Lucknow, then it's likely it's also raining in Delhi. That's the way to think about this. Plus, it's important to know, Karan, what do these data reveal? Well, effectively, they dispel the idea that India was somehow exceptional in having a low death rate. With these corrections, the Indian death rates from COVID look a lot like those of the US or Brazil. So the only exceptional thing about India is really its stubborn unwillingness to accept that its death rates were not exceptional.
The second concern the Indian government has with methodology, and I'll be honest here, is a little difficult for laymen like me to understand, so I'm going to quote it in the government's own words. The government says the test positivity for COVID-19 in India was never uniform throughout the country at any point of time. But this variation in COVID-19 positivity rate within India was not considered for modeling purposes. And that raises the question, does positivity have a direct relationship with mortality? And if it differs from state to state or region to region, does that throw up question marks about the estimated overall mortality?
It doesn't, Very probably because, as mentioned, the method involved taking data from 60% of the population and making conservative extrapolations to the remaining 40%. And those didn't really need to use the testing data. And one has to remember that testing itself changes during the pandemic. So it's problematic to use testing data. So we all know in the first wave, testing was very much restricted to high-risk groups. Then the government of India did a wonderful job and expand testing availability. But by April, May, June of 2021, in the killer Delta wave, testing was low. And the reasons are obvious. If one person in a house fell sick and was tested, everyone in the house would have not bothered to go test it, thinking, well, we're obviously infected, and why would they risk going out into a pandemic? So the testing results and the use of these statistics fell apart. India isn't alone in that. The Canadian testing results during the recent Omicron wave fell apart simply because there weren't enough test kits available. So this is why we need deaths, because you can escape testing, but if you're going to get killed by the virus, you can't really escape death. So this is a far more robust measure of the pandemic. And it's pretty simple to know who's dead or not. The same does not go for who's tested or not. So as mentioned, the main issue here is taking data from 60% of the population and extrapolating with very simple assumptions to the remaining 40%.
That's very beautifully put, Professor Jha. Even if it reveals a bit of morbid humor, it's very simple to know who's dead or not. It's not always easy to know through testing whether people are infected or not, but I think that underlines the point very accurately for the audience. Now, on the basis of the sort of concerns about methodology that I've cited, the government comes to what looks like a sort of conclusion about the WHO's methodology. And again, I'm going to quote the government. The government says the estimated number of deaths keep jumping from 13 lakh to 33 lakh to 63 lakh and then to 47 lakh. This is precisely what a government source has said to the Indian Express. And what they're suggesting is that the WHO had multiple estimates before they finally decided on the 4.7 million figure.
Well, as WHO got more data, as all of us got more data, we've updated the estimates. Even in our study, we've updated the estimates when the Ministry of Health has released more data from the 2 lakh hospitals. And you have to remember the 47 lakh estimate is a midpoint, and the uncertainty could be as small as 33 lakh or as large as 63 lakh. So I think for debate purposes, we should ask, could the 33 lakh total be correct? And as I mentioned earlier, about most of those occurring 2021 would require only a doubling of death rates for 3 months. So I don't think anyone would seriously doubt that during those terrible, terrible months of April, May, June of 2021, everyone did not know at least twice as many people dying as they would normally see. So I think the estimates are, you can get caught up in which models work and so forth, but common sense being common sense, it's very probable, it's very, very realistic to think that India had more than a doubling of death rates for a few months.
The problem with common sense is that very often common sense is not common at all. But the next two concerns I want to put to you are very possibly commonsensical based, if I can phrase it like that. And they come again from the Indian Express, but I'm not sure whether they've been told to the Express by a government source or whether they are concerns expressed by the Express's own correspondent. The first is connected to Kerala. Kerala has the highest deaths per million out of big states in India. It's 1950. Kerala is also believed to have a robust system of counting deaths, and many people believe it's close to 100%. Now, if you extrapolate Kerala's deaths per million to the entire country, you end up with 2.65 million COVID-linked deaths, not 4.7 million. That's another reason why at least the Express, or possibly government sources who spoke to the Express, do not accept the WHO figure.
Well, that's cherry picking. First of all, Kerala's overall COVID death rate is not higher than many other states. In fact, it's lower. And you taking data from 2.5% of India's population and saying you can extrapolate it to the rest, when it doesn't make sense when the government is objecting to taking data from 60% and extrapolating to the remaining 40%. So even if you accept the government of India argument, that would suggest about 26 lakh deaths occurred, not 5 lakh. So quite frankly, you can't have your jalebi and eat it too. You can't say both methods are wrong and right at the same time.
Absolutely. Now, here's another argument that's made against the WHO estimate. India is paying 50,000 for each COVID death. Given that is now laid down by the Supreme Court and cannot be avoided by any government, could it be that 4.7 million deaths are actually missing? Particularly when these are people who are poor, who would not only welcome the money but would need it. That's another reason why people say when money is being made available to the poorest who died, they will admit to the deaths and the numbers will go up, and you won't have 4.7 million deaths missing.
That's a fair question, but it's still early. And it might well be that in some families, both adults died, so they can't organize a claim. Full transparency about the claims would help. So again, I think putting all of the claims on a website, protecting anonymity, of course, and when they were filed, in which districts, and then the comparison to the district level death data, I think all of those would help. Some data journalists are trying to get at this information, but I can't really comment on the veracity of the reports of how many people have had claims. We also know that there's an important political decision in both directions, that some politicians might encourage families to file claims and others might discourage them. And so we don't know how this pans out. We have to rely on better data sources than one that involves a monetary incentive, because that creates distortions and in the end won't be very reliable. But I think I take the point, and I think more investigation is needed of those claims.
In all honesty, I should point out to you, Professor Jha, a fact again published by the Indian Express that actually works in your favor and supports what you're saying rather than the doubts created by this 50,000 thing I mentioned. The Indian Express says, and I'm quoting the paper of the 6th of May, that in 11 states that account for 75% of the official COVID death toll, the total applications for compensation, and by the way, that would include inflated and fraudulent applications as well, is just 884,000. That's less than double the actual COVID toll for those states, which is 390,000.
Yeah.
So if you extrapolate from this, you come nowhere near 4.7 million. So clearly, what the government is saying, if you look at the details and the facts, can work against it as well as the Express has shown.
I think we need to have more careful investigation of the claims, who's making it, to try to understand those. I wouldn't count on incomplete claims or early claims to be the basis for any estimate that the deaths weren't hugely increased. Again,
Okay.
it's a matter of judgment. You have to look at all data sources and not simply focus on the one that you like. That's just scientifically invalid to say, I like this number, I'm going to use it. You have to look at all the numbers.
We're coming to the end of this interview, but there are 2-3 questions I'd like to still put to you. Finally, the health ministry has said, and very possibly it said it tongue in cheek, that the mathematical model used for India should be validated by running it on tier 1 countries to prove its robustness and validity. What do you make of that suggestion?
Well, WHO has in fact done this. So consider Italy. Italy, as we all know, had a huge crisis early on in nursing homes and actually missed deaths. But it has a very robust reporting system and it fixed the reporting quickly. And its estimates of total excess deaths is 161,000 in 2020-21. And that's about the same as COVID deaths. And this is also WHO's estimate. So they ran the model and they came up with the same estimate, or they basically used the Italian estimate. Now if you contrast that to other model-based estimates done by the IHME and the Economist, they claimed Italy had 192,000 and 259,000. So those two models are yielding incorrect answers for Italy. WHO's is yielding correct answers. Now, to be fair, WHO didn't get it right everywhere. They probably overestimated the German death totals, but this was likely due to undercounting of the pre-pandemic deaths. And I believe the WHO team now is fixing these. And I think the principle is science means accepting when you're wrong. And in some cases, the team did get it wrong, but they're working hard to correct those.
And the important thing you pointed out is that the methodology used in India was used in a developed tier one country, Italy, and it validated the outcome completely. So the concern that India has that this methodology has only been used in tier two countries and not for tier one countries is not correct. Italy is the example that proves that it was used in a tier one country.
Yes.
Now, in an article that he wrote for the Indian Express on the 5th, Dr. Paul, Vinod Paul, who's effectively the head of India's COVID response, said, and I'm quoting him, "No matter how we count COVID-19 deaths, the exorbitantly high estimate over and above the officially reported number is out of the question." In other words, he's dismissed the WHO figure bluntly and forcefully. His words are out of the question. As a member of the technical advisory group, how do you respond to being told that something that you're associated with is out of the question?
I have great respect for my colleague, Dr. Paul, and he's a wonderful pediatrician and has made enormous contributions to child health in India. But I think on this, he's wrong, that the evidence from the totality of the studies, from the details of what the government has released so far. So look at the civil registration data for 2020. Look at the Ministry of Health's own website on what's happened to deaths in 2 lakh hospitals. And they all point, along with independent studies, to a very similar conclusion, that the Indian death rates have been vastly undercounted, and effectively, with the undercounts corrected, India's COVID death experience is about the same as Brazil or the US. So there's nothing exceptional about India in its death rate. And I would much rather have a focus and coming clean on that figure, so that the true successes of the COVID response in India, which is the extraordinarily effective vaccine campaign, can deserve the appropriate attention. So I believe it's actually a distraction to not focus and come clean on how many deaths did occur in India. It doesn't help the government going forward. It hampers its credibility in other areas where there really shouldn't be doubt about India's spectacularly successful vaccine program.
You made a very important point when you say that India's COVID death rate compares very well with the COVID death rate of the United States and Brazil, which are both countries with large populations and also large land masses. And within those large land masses, huge differences between different regions. All the concerns that the Indian government has brought up in criticizing the WHO methodology for India also are concerns that apply to America and Brazil because of the size of population and the huge landmass of those countries. That's a very important point that's been overlooked in India. Let me then put this to you. In an interview that you gave me in January, shortly after your own study of COVID deaths had been published, you said that the best way of sorting out the controversy of how many people had actually died of COVID-19 is for a question to be asked when the next census is done. Preparations for that census are presently underway. I believe it will happen either towards the latter half of this year or the early part of next year. Do you still stand by that suggestion today that a question should specifically be asked in the next census? I believe that happened in 1918 to find out the total death toll for the Spanish plague. Should we repeat it to find out the total death toll in the COVID pandemic?
I firmly believe so. And the simple way to settle the debate would be to add a question to the census. So my plea to the Prime Minister Modi and his team, if they're at all listening, would be very simple. If you add a simple question on the census, or two simple questions. First, was there a death in this household since January 1st, 2020? If yes, what was the age, sex, and date? And we have to remember the census means millions of survey staff will go to every home in India, and you would get correct, direct accounting of excess deaths. It would provide the information as to why death rates are varied and would actually help quantify how many lives did the extraordinarily successful vaccine program in India save. So my plea to the Prime Minister is that he knows very well that India gave the world the zero and transformed understanding of science and maths. And the simple step that I request is give the world this best practice, which is to put a simple question to count the COVID deaths on the upcoming census. That would be a service to India and to the world.
My very, very last question, Professor Jha, and it's not, I should tell you, about the controversy between the WHO and the Indian government over India's total COVID-related death tally. It's to do with something that struck my curiosity and led me to ask, why is this the case? It seems globally, more men than women have died of COVID. The global figure, I believe, is 57% men versus 43% women. And that's also true of India. In 2020, 5.3 lakh men over the age of 60 died of COVID compared to just 3.5 lakh women. Mm-hmm. In 2021, 19 lakh men died compared to 50 lakh women. How do you explain the fact that more men have died than women?
Well, COVID deaths are higher in those with existing chronic disease, such as heart disease and diabetes, but also in those that have risk factors, such as smoking and or obesity. So generally, I think we all know that Asian women are far more sensible than Asian men, and this includes in risk factors. So men in India have quite high rates of chronic disease as well as smoking. And this is very much the global pattern. Now, that's not to say women are protected. Women after menopause can very much converge with men in their chronic disease patterns. So they're also at risk. So this is a global finding, and it suggests the importance of not just dealing with the virus, but also the underlying poor distribution of non-communicable diseases that occurs right throughout the world.
So on a lighter note, the next time a husband tells his wife, darling, I'm not feeling too well, he's not shirking.
No, he's not.
Professor Jha, thank you very much for answering meticulously and in detail each and every one of the criticisms. I believe that I've put all the main criticisms of the Indian government, as well as several others that were taken from the papers, and you have not just answered, but you've rebutted each and every one of them. I thank you for your time. Take care. Stay safe.
Thank you very much.
Thank you very much indeed.